Hey everybody, my name is Dr. Philip Oob. I'm a functional medicine doctor here in Austin, Texas, and I want to talk a bit about what I know and what I've learned about COVID-19. I am by no means an expert on virology or infectious disease or anything. I'm just a doctor trying to put what I know and practical advice that I have seen through the internet and my research through different avenues, and here's my presentation on it. This PowerPoint presentation is easily available if you just text COVID-19 to this number, 415-528-7403. You'll get a link to download the presentation. You can also go to my website, oobmedical, O-U-B-R-E, medical.com/COVID-19, fill out the form, and it'll automatically text your presentation to you. Okay, so let's dive into this PowerPoint presentation and go through it. So first I want to say that this is real. This is actually happening. I was one of the people that was saying this was another SARS epidemic and this was another just another flu virus and this is going to be no big deal. But as the numbers and cases started spreading, especially as what happened to Italy happened, it's time to start taking this seriously, and we have certainly taken things more seriously in our practice. So first, I just want to go through some of the numbers so that you understand what's going on. And I want to say that in America, at least in Texas, I can tell you that the numbers are drastically underreported because currently in my practice, it is March 16th. I still do not have any test kits in hand. So it's pretty hard for me to say that there are no coronaviruses in my practice if I don't even have the ability to test. So I think our ability to test is drastically low, and thus our numbers are really low. So let's go through just with the numbers that we do know in America or in general about COVID-19. Each infected person infects another 2 to 4 more people. And so with this rate of spread, there is a doubling of cases every 6 days. So that doesn't sound too bad until you realize that the logarithmic increase of that. So if you fast forward 6 weeks, there's going to be 1 million cases by April 30th. That's 6 weeks from now. That doesn't sound so bad. 6 weeks and to gain 1 million cases over 6 weeks isn't too bad. But remember, it's doubling every 6 days at that current rate. So fast forward, you've got another 1 million in 7 days, when previously it took you 6 weeks to get there. This is why it's incredibly overwhelming to the hospital system if this actually occurs. Fast forward another week, and now you have 4 million people affected. From 1 to 2 to 4, and I'm assuming you can do math and say another week goes by, that's 8 million people. Now, just putting some simple math, stopping at May 13th, which is about 2 months from now, that if we take some simple math and say 1 to 3% mortality, actually I had to fix these numbers, don't tell anybody. If you take a 1 to 3% mortality and multiply that by 4 million people, that is 40,000 deaths. And if you take the 3% mortality number, that's 120,000 deaths. Now that's with the current mortality rate. That's not even suggesting that if we overrun our hospital systems, what's going to happen to healthy people who can't maybe access care. Now it's really easy to talk about all these numbers and things, but what does this actually mean? How does this compare to other diseases that we've kind of seen, all right? So I looked up some basic numbers to get my own perception of what we're dealing with. So as you know, the flu kills people every year, and it's not any surprise. It's the same elderly, newborns, asthma, COPD, those kind of things, and we've kind of grown to accept those deaths as, oh, okay, that's just part of the virus. But to put this in perspective of what's happening, in 2018, we had one of the worst influenza cases since 2009. There were 61,000 deaths. So let's go back to this number over here. 4 million people infected by May 13th with a low 1% mortality rate. That's 40,000 people. So the worst flu case that we've had in 2018 killed 61,000 people, and this is just May 13th. Now, as I said already, that's the highest since 2009 influenza. SARS only infected 8,000 people. I didn't even know the numbers were this small, but this is why we didn't overreact, and 774 people died. Correct me if I'm wrong on my numbers, but this is what I found by some quick Googling. What we know at this point, March 16th, 2020, it kind of got cut off, but 6,400 people have already died as of March 16th. Now, I'm pretty sure that's globally, but nonetheless, you've got 6,400. This is not a SARS epidemic, guys. This is not anything. This is a totally different comparison. And as of March 16th, we are still on the rise, and this is what's scary. So now that we understand that this is a very real phenomenon, I want to go through some basics. What is COVID-19? And as you probably already know, it is a coronavirus. Novel just means a brand new one. And so the pathogen is a coronavirus, which gives it this crown-like appearance, and that's what you see on it. Corona means crown. The symptoms are called COVID-19. Why is it called COVID-19? The acronym stands for Coronavirus Disease 2019. That's all that stood for. And so now you know why it's called COVID-19. Now it looks like everyone's hyphenating it, and I was not hyphenating it, so I'm a little behind the times. But the main thing I've been telling people is that you're going to get it, and you need to go into that with that expectation that you are most likely going to get it. As Dr. Sinclair suggested, it looks like 33 to 75% of the American population is going to get the coronavirus. So even at 33% chance, that's a pretty high risk of getting it. And at 75%, you can pretty much guarantee that you are going to get it. Now, the reason why it won't reach 100% is, of course, we've got rural areas where people are already socially distanced and nowhere near others. So they most likely won't get it. Herd immunity will protect them. But if you're in a city like I am in Austin, you can pretty much guarantee that you're going to get it. And that's why you're seeing the big outbreaks in the big cities. But the important thing to remember is that with this 1 to 3% mortality rate, don't freak out. You have a 98% chance of not dying, okay? So you can look at it as 1 to 3% chance that you're gonna die, oh my gosh, or a 97 to 99% chance that you're not gonna die. You're gonna get sick, you're not gonna feel good, you may have a fever, you may not be able to go to work, you shouldn't go to work, all those things, but you're probably not gonna die. You may feel like you are, but you're not. So why are we panicking? Right? Why are we panicking? The reason why there's all the panic right now is because healthy people are the ones that are spreading it, right? The healthy people are out and about, they're going to visit grandma, they're going to make sure so-and-so's okay, they're out grocery shopping. We are the ones that get infected, and we are the ones that spread it to the at-risk population, right? The big concern is that we'll overwhelm the hospital systems, and that's what you're going to see in my next slide. And so that's why the important part is to flatten the curve. So let's go into what flatten the curve means. If you haven't seen this diagram already, I'm surprised. My Facebook feed is full of it, and but I'm in healthcare, so maybe that's just me. So the main thing that you need to realize is that if we do nothing to social isolate and to slow this spread down, you have this massive spike. That's that logarithmic curve of where you easily go from 1 million to 2 million to 4 million to 8 million, and that's that scary spike. If we do this, this line you see here is the healthcare system's capacity. If we can't get, if you can't get treatment, there will be rationing of healthcare, or probably won't even be decisions of who can't get care. It's just if you can't find a hospital to go to that will take you because they're full, that's it. You're just stuck on your own. Now, this is incredibly personal to me, and I don't know if you know my battle, but I recently went through a pneumonia, a healthy 38-year-old guy who got pneumonia and ended up having to get a chest tube and surgery to drain the fluid in my chest. Now this was back in January, and it's very possible I was an early coronavirus case before we knew about it, but I don't know, and it doesn't really matter. But the fact is that if this is happening and I developed what I developed in January, then I may not even get access to care. The big scary part here is that this 1 to 3% mortality rate everyone's talking about, that's no big deal. Oh, it'll kill off the elderly. Who cares about them? They've lived a healthy life. That is not going to happen if we end up way up here. There will be many, many healthy people that had bad luck, kind of like me with whatever I had, that got pleural effusions and complications of the disease and ended up dying unnecessarily because we just didn't have the healthcare capacity to keep up with it. I don't know if you know this, but during the flu season, the hospital systems are already stressed. Now, luckily, the flu season has mostly died out, but just in a regular flu season, the hospital systems are already stressed. You've probably heard that hospitals are already running out of masks and gowns and protective equipment, which means the spread is going to go even faster. And healthcare workers are even the ones getting sick and severely sick. And there are some reasons for that. But anyway, the point of this of flattening the curve is not to decrease the amount of people that get it. If you actually look at the area under the curve, if you were forced into calculus like I was, This big shaded area in the red zone is called area under the curve. See, here's my calculus coming to use, and I thought I'd never use it. But this red shaded area is called area under the curve, and that's how many people will ultimately get infected. Now, if you look at the blue curve, there's just as much area under the curve, or supposed to be, just as much area under the curve, meaning just as many people get infected, but it's spread out over time so that hopefully the healthcare system can keep up. Now, you can think that, oh, we have enough ventilators, we've got the best healthcare system in the world, and blah, blah, blah. You can believe all that you want until you're the one suffering, looking for a hospital bed and no one to treat you. So this is a very real concern, and God, I hope it never comes to this, but we all need to be doing our part to try to keep under this healthcare capacity burden, and we'll only know after it's done. Hopefully we'll look back and say, wow, we drastically over-prepared and we didn't need that at all. But so far, it's looking sketchy. So what can you do to prevent the spread? What can you do to flatten the curve? I was initially under the impression that this was just like the flu virus, SARS, all that. It's an airborne spread, but it looks like it's becoming more and more of a surface spread virus. Surface spread meaning it's really sticky and sticks to surfaces, and it can live on surfaces for an unusual amount of time. I think I saw something that said it could live on a surface for up to 9 days, which is absolutely crazy. And so it's spreading wildly because of that. Any touching of the face, and I mean, I've got a bad habit of touching my face, chewing on pencils and all kinds of stuff. So I'm already planning to go down unless I had it already. But anyway, so how can you limit the spread? You can wash your hands as much as possible. Everyone's always talking about washing your hands, going to the bathroom and all that, and that's great and all. I'm putting here that you should try to be washing your hands every 4 hours, if not more often. It's okay to not go to wash your hand even when you're not going to the bathroom. So this idea that our genitals are the source of the spread is not the idea. It's mostly still spread by respiratory droplets spread to the hands and then touching doorknobs and handles and whatnot. So washing hands anytime you come in contact with anyone is advised. So like you can see, these guys are fogging down the place, wiping down the computers and whatnot. Do the best you can at cleaning everything. I know things are on shortage, but you don't need some special Lysol, Clorox wipe. Just regular soap and water. Let's not forget, just a regular bucket of water, add a little bit of soap. Now you've got plenty of cleaning product. You may have to go back with a wet rag and wipe the soap off, but that works perfectly fine for your household and your office, except computer equipment. Social distancing, everyone has talked about that enough. I don't need to talk about that. And then, of course, avoiding people with symptoms or high risk is obviously the thing to do. Airborne, I just want to point out, I don't think enough people are talking about the solution to pollution is dilution. And what I mean by that is one of the ways to dilute out airborne illnesses is to just open the windows, let air flow in and out, and dilute those viral particles. The problem with airplanes and office buildings and restaurants and things is that it's a closed container recirculating the same air, your house recirculating the same air. So if you're going outside, if you're going to socialize, try to go to places with outdoor porches or whatnot where you're diluting the air. I mean, obviously, if this is surface spread, it's not going to help you, but it can at least cut down on the airborne spread. And then, of course, use air purifiers in your office and at your home, but chances are if you have it at home, you're already going to get it and spread it to all your family members anyway. So I'm encouraging people to bring the air purifiers to work to try to cut down on the spread. So what are the symptoms of COVID-19? I feel like this is not fully understood yet, despite how many people have gotten sick. I feel like there's a lot of fake reports or people publicizing on YouTube what their symptoms were like, but this is kind of what the common thread seems to look like, and oddly enough, it mirrors my case in January. And so the first symptoms are usually a sniffle, kind of like a cold, no big deal. Then within a few days, you get a pretty abrupt flu-like feeling, which is fever, body aches. Supposedly you can get pretty high fevers. The second week, you get a little bit recovered and start feeling a bit better, and then you get severe again if your case is going to progress into the worsening. Some people just recover with that feeling of recovery and move on. And many people seem to have an asymptomatic course, meaning no symptoms, but they still got the virus, so everyone's a little different. If you get the more severe course, you get a double worsening, or you get worse again, and then a pneumonia can develop. Now, this is a viral pneumonia, meaning the virus is infecting the lungs. So antibiotics won't work for a viral pneumonia. You can't really tell based on chest x-ray all the time whether it's a virus or a bacteria. So it could be a bacteria, and bacteria like to set up pneumonias after a viral infection. So it's hard to tell the difference. Of course, with a pneumonia, you'll develop shortness of breath. And if you're like me, you'll actually develop fluid around your lungs that needs to be drained, one of the worst complications of this situation. And then this virus can also cause heart inflammation, or the sac of the heart called the pericardium. It can get inflamed, and it's called pericarditis, and that can unfortunately cause some very serious complications. So obviously, the sicker you are, the more immunocompromised you are, the more complications you have in that area, whether it be COPD from smoking or heart disease from heart attacks, that puts you at higher risk for either of those conditions. As far as, well, I think this came from ourworldindata.org, from the World Health Organization. These are the most common symptoms. So fever is the 88% symptom. So if you have a fever right now, anywhere in the world, chances are you've got COVID-19. If you've got a dry cough, that's 68%. Next is fatigue. None of those three things are that specific for COVID-19, but right now with the pandemic going on, it's most likely not the flu. It's most likely not a regular cold. It's COVID-19, no matter how severe or mild your symptoms are. Some people get sputum, which is mucus. Even more people get shortness of breath. 18% of people get shortness of breath. That's a pretty high amount of shortness of breath for a regular viral illness that's like a cold. So needless to say, this is one of the reasons why the mortality rate is a little higher. Just to run through the rest of them: muscle pain, joint pain, sore throat, headaches, chills, nausea, vomiting, nasal congestion, and diarrhea is 3.7%. Despite our toilet paper shortage in America, diarrhea does happen, which I was glad to know with our toilet paper shortage, but it's only 3.7%, so stop panic buying toilet paper. So when to get tested? Right now, this is a tough question to answer because test kits are limited. I still don't have any test kits in my office. I apparently have 10 on the way. I won't believe that until I actually have them in hand, but that's how the shortage is right now with the test kits, that if you're otherwise healthy, you may want to skip the test, but if you're worried that you might infect your grandpa or kid or whatever it may be in your house, then it may be worth getting some tested. So if you have symptoms, obviously you should consider getting tested. If you are exposed but don't have any symptoms yet, it may not be a good idea to get tested because you may get a false negative report, meaning, oh, I tested negative so I don't have it, but you tested too early and thus you couldn't have it. It is a nasal swab testing, just so you know, and if you've ever had a nasal swab, like this lady's coming at the patient with a nasal swab in her hand, it's not a fun test to do, so it's not something you'll want to do twice. And of course, as I mentioned already, that the test kits are limited. Right now, they're telling us it's about a 48-hour turnaround time, but I won't believe that until I actually see a test and result in hand. So how do I get tested? Here in our office, we can test as soon as we get our test kits. We are setting up an isolation room to where patients that want to be tested or need to be evaluated are immediately brought to an isolation room. Everything is wiped down, that anything that they touch on the way in, they're given gowns and masks and all that. We're going to be trying to provide house calls and house infusions at home. That'll be for additional fees. If you live in Austin, you're welcome to contact us. There's drive-through testing set up. We're going to try to do the same thing, test people in the car. If they don't need anything in our office, then we'll just try to test you in the car so that you're not exposing our staff or anyone to the disease. And you can look up in your area. They're setting up drive-through clinics as we speak. I heard one was open in Austin today, but I heard it's moving, so it's questionable whether it's going to stay open. But look for drive-through testing that's available. So what do you do if you're positive? I tested positive for COVID-19. Now what? Stay calm, right? I read our blog. So recently we posted a blog on our 3 perspective from our therapist, our nutritionist, and our nurse practitioner. What should you do? And the therapist advice was spot on. First of all, stay calm. You can't not get it anymore. Now you have it. So freaking out and driving yourself mad is not going to help your immune system. You've got to believe and emulate and manifest that you are going to be well. Do breathing exercises, whatever it may be to calm you down, use supplements to calm you down, whatever it may be, keep calm because stress is an immune suppressant. Remember that there's a 97 and 99% chance of survival, so go with those odds instead of the 1 to 3% chance of dying. It's all about the story you tell yourself. Of course, once you're infected, limit your spread. The big thing I can't emphasize enough is avoid the hospital, avoid your doctor's office at all possible. Right now, with everyone in the media craze, you get COVID-19, you think you might be dying, 98% chance that you're going to survive. So avoid the hospital unless you're having complications, unless you're so significantly short of breath that you need evaluation or wheezing or whatever it may be. Of course, go to the hospital, go to the doctor if you need to. But if you are just healthy, avoid the places that are going to get overrun as this disease spreads. And the current recommendation is be quarantined for 14 days. I saw a report where the virus can actually shed for 30 days or 37 days or something ridiculous. But the current recommendation is quarantine yourself for 14 days from the start of symptoms, as far as I know right now. As I said, we'll be setting up an isolation room for testing and high-dose vitamin C infusions, which have shown some promise, but I can't promise that it's going to work for everyone. So what are the risk factors? If I have it, when should I be worried kind of deal? The risk factors are, of course, or not of course, but it seems to be above 60. Flu likes to get newborns, and this seems to be completely different, that this virus doesn't really injure newborns and younger kids nearly as much as the influenza. But over 60 has a significant increase in mortality. I've got the chart on the next page. Of course, if you're immunocompromised, this virus is going to spread faster in your system and cause more illness. If you have COPD, which is chronic obstructive pulmonary disease, any kind of lung disease, any kind of lung scarring, lung surgery, whatever it may be, you're at increased risk because this is a lung virus. And if it's going to cause shortness of breath and you already have dysfunctional lungs, it's going to push you deeper in and more likely to need hospitalization. Of course, smokers, they have high likelihood of having COPD or just damaged lungs in general. Asthmatics are more likely to have issues. And then, of course, obesity, that's from a restrictive component. When you're obese, your weight kind of crushes on your lungs, and that reduces your ability to breathe, of course. It raises your risk. And then diabetes, they're saying something about the sugar molecules that are attached to the hemoglobin seem to increase the diabetics risk. That whole test we do for diabetes, the hemoglobin A1C, those are sugar molecules attached to the hemoglobin. And for some reason, the virus seems to affect people with higher hemoglobin A1C counts more than others. There's also some concern, I think it's in one of my slides, about the virus can push the heme out of the hemoglobin or the iron out of the heme molecule, and then you can't transport as much oxygen, which may contribute to its mortality rate. So this is the mortality by age, and I thought this was really fascinating. Let me try to get out of the way. Is that really there's no uptick in mortality up until your 50s, but really 60s. So below 50, you've got a less than 1% chance of dying. And look at the 0 to 9-year-olds. There's been no fatalities. I don't have a date on when this was reported. But above 50, you've got a 1.3% chance. Above 60, 3.6%. And then once you get to 70, it's an 8% chance. And then above 80, you've got a 14.8% chance. And if you look at the death rate with confirmed cases, it's 22%. So be checking on your elderly parents, be aware of them, but try not to contact them more than you need to, and certainly try to limit the spread. Socially, it's really important to socially isolate the above 60-year-olds right now. So when do I get evaluated? If you're having shortness of breath, if you're having chest pain, low blood pressure, low oxygen saturation, nowadays anyone and everyone can buy those oxygen saturation machines that you put on your fingertip. They're pretty cheap on Amazon, although they might be selling out like everything is right now. So if your oxygen saturation is dropping, that's suggesting that there's too much fluid in the lungs and you're having shortness of breath, and you may need further treatment, medical care. And then if your fever is over 104. Now, real quick, I want to talk about a fever. In medicine, we commonly measure fevers and talk about it, but I think we need to take some of the emphasis off of the temperature. So if you have a fever, if you have a temperature above 100.4, you're considered to have a fever. But fevers don't kill people. So usually, no matter if your temperature is 100.4 or 103, that has no bearing on your illness, really. If it's over 100.4, you're sick. You don't feel good. And yeah, as it gets higher and higher, you feel worse and worse. But it's not necessarily correlated with any mortality that I know of. So don't panic because you have a fever. You don't need to treat with Tylenol. You don't need to treat with ibuprofen. Some of those drugs have side effects, and actually some of the early reports I'm seeing are saying avoid NSAIDs, avoid Tylenol. It seems to do worse with the disease, do worse with the virus. But that's early reports right now, so I don't want to sound like an expert there for sure. So those are some reasons to get evaluated, but let's remember, avoid the doctor if your fever is not over 104. It's pretty hard to break 104, so if you're above 104, that's reasonable to get seen. You can't really cook your brain until it's over 104, so that's a reason that the 104 is a cutoff. I think it's technically 106 to cook your brain like an egg, so even at 104, it's scary, doesn't feel good, but time to get seen. Cough, runny nose, fatigue, body aches, those are all very, very common symptoms. Please avoid the healthcare system so that we have room when this starts to take off and we have supplies that aren't wasted on otherwise healthy people. Okay. What will my test look like? I don't think this is that important for most people, but I stole this diagram from someone else on Reddit that my little brother sent. And so this is mostly for medical people, but I'll walk you through it real quick. So WPC stands for white blood cells. So your white blood cells are more likely to be decreased or normal. Your platelets are likely to be decreased. Your hemoglobin or anemia count is likely to be normal. Your liver functions, AST and ALT, are more likely to be elevated, as well as your total bilirubin likely to be elevated. These are just saying liver stress. The body's inflamed. The liver's trying to take care of it. Maybe the virus is actually infecting the liver and things are inflamed, so that liver is beefing up. AST, ALT can also come from heart cells and blood cells and muscle cells. So those can be elevated for numerous reasons, not just because the liver is elevated. And then, of course, BUN and creatinine, which are kidney markers, can be elevated, suggesting that your body just needs more fluid. It's having a hard time maintaining fluid. With a fever, you lose lots of fluid through your skin. Whether you realize you're sweating or not, with a fever, you are exuding fluid. So if you do have a fever, make sure you're keeping up with your salt and water intake. We frequently focus on water, but it's important to know that the body can't absorb water without salt. So you always want to try to have some sort of salt following the water, whether that's some sort of salty food. You don't necessarily need to salt your water. That sounds nasty, but some sort of salty food. And that's why I'm a big believer that soup is a good thing when you're sick. It's got the water, it's got the salt typically. That was not the time to go for low sodium foods. I'm not a big fan of low sodium foods anyway. So more on I have COVID-19, now what? There's tons of people out there saying, take my supplements, take these supplements, whatever it may be. In general, my opinion is that if you've waited until now to get healthy, if you've waited until now to take supplements, it's probably too late. Will it hurt to take supplements? Probably not. Are the stores going to sell out? Probably, because everyone's running around trying to buy supplements thinking that that's going to save them. The most important thing you can do right now, gosh, I don't even know if I mentioned it, but eat really nutrient-dense foods, avoid sugars, and it's in my PDF. So if you send a text to that COVID-19 number, if you go to my website, oobmedical.com/COVID-19, I've got my top 10 immune boosting tips, and it talks about food and nutrition. So the one thing we're recommending to our patients, because it's one thing that we can do that seems beneficial and it's worked well for other viral illnesses like the flu and colds, is we do these high-dose vitamin C infusions. And just so you know, the amount of vitamin C that we can infuse is tremendously different than the amount you can eat or take in a supplement. The high-dose vitamin C is 25,000 milligrams IV, and typically when you take the pills, it's 500 to 1,000 milligrams. And if you try to take that amount orally, then you're going to have disaster pants, which is code word for diarrhea, massive diarrhea. So this amount we can give IV seems to have this surge effect on the immune system and helps fight viral illnesses. Once again, I have no proof that it works for COVID-19. There's some reports coming out of China saying that it worked, but once again, loosely held together. So as far as what supplements to take, iron may be something that we've found because of this whole virus can kick out the iron molecule from the heme protein in your blood cells. So if you have enough iron, you may not suffer as much shortness of breath, but there's no proof to that yet. And then of course, there's some supplements on our blog of what we recommend to take if you want to take supplements. But remember, you can try to take as many supplements as you want, but typically we recommend these things way ahead of time to restore your body's levels of these before you get sick, hence the preventive medicine. As far as medications, I usually try to warn people when you're taking over-the-counter medications for colds, flus, whatever it may be, avoid the multiple drugs, the ones that say, oh, this is the drug that works for coughing, sneezing, runny nose, the nausea, fevers, everything. That's more likely to have 3 and 4 drugs in one pill. And if you take that drug and then you say, oh, I want some Tylenol too, now you've technically overdosed because you got Tylenol in that medication and you got Tylenol separately. And so you're more likely to take an overdose or more medication than is beneficial. And so if you're taking more than is beneficial, then you actually have more risk and more side effect than you need to. So if you buy over-the-counter medications, try to buy single ingredient medications and take each one individually. And of course, avoid drugs if possible. We still don't know what's going to work for this COVID-19. So for your runny nose, use a Kleenex, blow it out. Don't try to medicate your way out of it. So more on this topic. I have COVID-19. Now what? Avoid antibiotics. This is a viral infection. Antibiotics are not going to do anything for you. They're not going to help you fight it faster. And another thing I'm worried about is with the amount of cases that we're going to get, there are going to be secondary complications of people getting sinus infections and pneumonias and things, and they will need antibiotics. So please do your public duty. Even if you feel like you've developed a mild sinus infection, maybe you should avoid antibiotics this time, because if everyone goes out and tries to get antibiotics, it's going to be just like the toilet paper. We're not going to have enough antibiotics for the really sick people. And God forbid you're one of the people that are sick that needed that antibiotic that now we can't get because it's on shortage. And remember that there's a lot of trade that's shut down, so it's not like we can really replete our stores. We get a lot of medications from overseas, as you probably already know. So we may not have enough to maintain this whole fight. Avoid steroids unless you really need to, unless your doctor is suggesting it. But it seems like, and I got this from Dr. Sinclair, that steroids might not be as beneficial as you would think for most viral infections. They typically help you feel better and help you fight the symptoms of it, not necessarily fight the disease, because steroids are an immunosuppressant, but they usually help you feel better through it, and that may not be the case for COVID-19. Just to put some reality out there, I hear people talking about the vaccine and all that, and as that is a possible hope, and I don't care where you stand on the vaccine or anti-vax, but the truth is that developing a vaccine to possibly slow the rate of spread is far away. Dr. Sinclair quoted 18 months, and that's what I would expect, that it would take at least a year to develop a vaccine. And even if it is developed, can you imagine the amount of effort and time it's going to take to provide enough to start vaccinating people? So that's not going to take us out of this crisis. It may help us from future coronavirus flares or epidemics, pandemics, but not this one. And then there are currently no antiviral drugs available for this. There's already reports that chloroquine, a malarial drug, is working. Vialgan, cyclovir, which we use for CMV or cytomegalovirus, that may have some hope. And then there's some HIV medications that are claiming cure and all this. But be careful what you read. No one really knows what's treating this. No one really knows what's going to work. And if there were a treatment out there that were curative and that awesome, then I guarantee you would know about it and it would be working. So that's kind of my spiel on the COVID-19 and hopefully the practical advice. Of course, as you know me, I could probably talk for hours on any topic, but we will suffice it to leave it there. I want you to know that I've put together a PDF, a free PDF of my top 10 immune boosting tips. And hence the Superman reference is actually in my PDF. It's the reference there is that Superman is actually recharged by the sunlight, if you didn't know that. And so one of my tips is to get out there and get some sunlight. Now keep your social distance and stuff, but the sunlight in nature has a lot of power that we don't even understand yet. So get out there, get a breath of fresh air, try not to get cabin fever with all this isolation. So, coronavirus, I've got it. No, I'm talking too much. So to get my PDF, you text the number 415-528-7403. Text COVID-19 without the hyphen, because I'm behind the times apparently. Text COVID-19 to that number and you should get a response back for email, and then you'll get the email for the PDF and my PowerPoint presentation. And then you can go online, get the same thing, oobmedical.com/COVID-19 there. And then of course I just put in there to remind me to tell you that I have a YouTube page, I have a Facebook page where we're constantly putting out tips and tricks and blogs, and I put out videos for how to stay healthy and how to prevent disease. The idea is that now with this outbreak, if you have been taking care of your body, you are likely to be in that 98% survival. Whereas if you haven't been taking care of your body and eating French fries and hamburgers and smoking cigarettes and not exercising, your body's not likely to be in the healthy place it needs to fight this virus. But it is not too late. This pandemic will go on for quite a while. I don't know the timing. Based on those numbers, it sounds like it's going to go on for weeks to months. So it's never too late to start eating healthy. I know food is on shortage right now, but do the best you can to not just eat junk food while sitting on the couch. Now is the time to eat the best you can. And so download my PDF. I go through some of the tips to how to make eating clean simple and not overcomplicate things. I hope this presentation was helpful. Please share it with anyone that you do think it's going to be helpful for. And this is going to be a tough time and quite possibly a serious disaster that's going to compete with 9/11, all the other things that have happened to us. Siri's trying to listen now. And so, be kind to one another, spread generosity, and do what we can to take care of one another. Hopefully, once this is all over, we will look back and say, wow, we drastically overreacted. But that would be a good thing if we look back and say this was an overreaction. If we overrun our hospital systems and innocent, young, healthy people die, we will have a lot of regret and a lot of remorse. So that's all I have to say right now. It's March 16th, and we will know more as time goes on. Thanks, guys.